Fentanyl to me is a destroyer of families, a destroyer of community, a destroyer of good people. It's poison.
Fentanyl is one of the biggest, if not the biggest, issue in our community today.
The fentanyl crisis that's affecting the Coachella Valley is real, and it's deadly.
This thing is unlike any other drug that we've seen over the years. It's flooded the streets out here.
It's in affluent communities. It's in urban communities. It's in rural communities. It's in our schools, our workplaces.
Regardless of your socioeconomic status, your religious status, this is an everyone problem every day.
It affects the whole valley.
Fentanyl is cut in just about any substance you can find.
7 out of 10 pills are now fentanyl.
People don't necessarily know what they're taking.
I've had a few overdoses. You're playing with fire.
Vietnam, 58,000 people died. 2 times that die in 1 year from fentanyl, and Vietnam went on for 10 years.
You can't arrest your way out of this problem.
Our community needs to get involved.
It all has to start somewhere.
Coming together to fight fentanyl is, I think, the only way.
Coachella Valley is now second in Riverside County for the number of fatal overdoses that involve fentanyl. Overdose prevention is a collaborative effort. It involves multidisciplinary partners coming together to fight this fentanyl crisis.
With the Desert Healthcare District, we sat down and we developed the Fentanyl Harm Reduction Awareness Education Project.
We worked closely with the City of Indio Mayor's Office and our community stakeholders in Indio, all coming together to work in a combined way to address this crisis.
ABC Recovery Center and our involvement with the Fentanyl Harm Reduction Education Project is critical for awareness and to reduce stigma in our local community, not just Indio, but the whole entire Coachella Valley.
It starts with awareness, then education, and definitely action.
Fentanyl is a pharmaceutical that was approved by the FDA to treat severe pain associated with surgery or late-stage cancer treatment. Illicitly manufactured fentanyl is now surfacing in our communities and impacting our community members and driving up the overdose death rates exponentially. Fentanyl is 50 times more powerful than heroin. A one-time usage can prove to be fatal.
After my relapse, I went back looking for heroin, and all there was fentanyl. I knew it was dangerous, but I figured with my prior opiate experiences, I would be able to handle it. There was a lot more scary experiences with overdose. I've watched people overdose that haven't come back from it.
The amount of fentanyl is very small, less than 2 milligrams that could kill you.
Most oftentimes, our fentanyl overdose deaths aren't fentanyl alone. There's other drugs in a person's toxicology.
Fentanyl's being found in not just the scary drugs like heroin or meth, but also in what's commonly taken at parties.
Teenagers, they were 16 or 17 years old. They were given what they thought was Molly, and it had fentanyl in it. They end up overdosing and dying over it.
The most common counterfeit is going to be known as blues. They are small, little pressed pills with an M on one side and a 30 on another. Typically that's oxycodone is a prescription pain medication.
You may have a good kid that just makes one choice. You know, it could very well be the last choice that they get to make.
It's one pill, and their parents are finding them dead in their bedroom.
If they're going in thinking they can safely take oxycodone or an M30 and it's really just fentanyl, then they've been poisoned. They were taking something without knowing it.
In all my years in law enforcement, never had a drug affect every demographic within our community.
Each overdose death in our county is not just a number to me. It represents someone's friend, someone's coworker, someone's parent, someone's sibling, someone's son.
Michael is my middle child, my only son. And Michael passed away October 23rd of 2021 due to fentanyl poisoning. He had just turned 30 years old. I'm sure I was that person that thought, oh, this wouldn't happen to me. We're a middle-class family. He had everything he needed as a kid, as a teenager. He was very athletic, very artistic, very generous, always just had the greatest laugh. I wasn't really familiar with fentanyl at all. I'd heard about it on the news a couple times. I knew that it was causing death. When Michael told us that he had substance use disorder, I wasn't sure what I was going to do. Both my husband and I have our master's degree. My daughter's a nurse. My son-in-law's a family and marriage therapist. My other daughter's an attorney. The five of us were scrambling to do whatever we could to help Michael. What can we do? Where can he go? What does he need? I said to him, I don't want you to die. And he said, I don't want to die. You know it's a possibility, but you don't really believe that it's a possibility. I had gone for a bike ride in the morning, and my husband was home, and he told me to sit down. And he said, Michael passed away. It's not something a parent should ever have to deal with, because we're not supposed to outlive our children. Michael was a good kid. I'm trying to educate people to not have the same attitude about addiction that I used to have. I really don't want any other family to experience what our family's gone through.
Something that really makes me hopeful is seeing how many more resources are available today than ever before.
There are 2 harm reduction tools that we have introduced to our community as part of our project. The first one is naloxone, which is often referred to as Narcan. And the second harm reduction tool is fentanyl testing strips.
Narcan saves lives, it's easy to use, and anyone can do it. It reverses overdoses when someone is experiencing one.
Here at the facility, we probably brought 12 people back from death.
Our officers have received additional training to be able to deploy Narcan, and you could see an immediate impact on overdoses.
I've had a few overdoses, and Narcan did save my life. I hope I am proof that harm reduction can save lives.
Harm reduction does not promote drug use, it just makes drug use safer.
We already have harm reduction throughout our lives every day.
We put our seatbelt on because we know that hundreds of thousands of people die every year from car accidents. We don't stigmatize seatbelts. It's no different than naloxone or fentanyl testing strips.
Naloxone should be in every single household's medicine cabinet.
In our schools, in our neighborhoods, our libraries.
It should be in restaurants and clubs and bars.
It should be in bowls at front reception desk.
Your kids should have it in their car.
Narcan should be available everywhere.
It is a basic first aid necessity.
All you really need to do to help is to carry a naloxone inhaler on you. It helped save my life.
No one should die of something that's preventable.
I think that some people get a little caught up with how they can get involved and how they can make an impact. ABC and Desert Healthcare District and other community-minded organizations are there to help you along the way.
Open conversation where we're doing it together, that's what's going to make a difference.
Information is power.
Learn and be aware of the signs and symptoms.
It starts with conversations at the dinner table. It starts with your family, your siblings, your loved ones.
You never know if someone in your life is experiencing addiction or substance use that can lead to an overdose death.
One thing we say at Indio Police Department, it's our community and our commitment. And I say that to our community, that it's your commitment to ensure that you have the opportunity to provide assistance when assistance is needed.
The Good Samaritan law states that you can render first aid to somebody, or you could administer Narcan to that person, and that you won't be charged for negligence.
That law exists to really remove that additional hesitancy or barrier to helping someone.
All the organizations involved in the Coachella Valley are taking a better approach to dealing with this crisis. And I think it's important for the community to know overall that there are resources available. You don't have to navigate this process alone.
There's hope out there and there's help out there.
You can save a life.
Recovery is possible.
Education is key.
It's going to take all of us.
Fighting fentanyl together.
Fighting fentanyl together.
Fighting fentanyl together.
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 Fighting fentanyl together.